Thank you. Well, now, swiftly into the afternoon session. So hopefully you can see by your screens that we're joined by key partners. We've got Dr. Amy Pollard from the Mental Health Collective, and we've got the Right Honourable Baroness Armstrong of Hilltop, and we've got Professor Michael Preston-Shoot, and we're going to have from our colleagues some input, about 20 minutes each, and then time for questions. Can I encourage you to use the question facility on the screen? Do that as soon as you like. Don't wait till the question slot. Just keep going and feed the questions through, and I'll have an opportunity to look at those and tee up our speakers as we go along. I wanted to, with the first slide, please, just though say that ADASS have been thinking about social inclusion and justice as our priority. I mean, necessarily, there are a wide range of considerations in relation to this. It's a wide scope. It includes, for example, the rights and value of disabled people. It includes perhaps housing rights and homelessness and rough sleeping, the experience of Black and minority ethnic people, racism and racial discrimination, and Black Lives Matter considerations. It might include anti-poverty work and the role that local authorities could find themselves or indeed re-find themselves working in. And it certainly includes health inequalities, employment rights. And I think it includes those people, including prisoners who are at risk of exclusion in our society. So a wide scope, but also the obvious point that we can't do this on our own, certainly not in ADASS, but also in our organisations. We have to do this thinking about how we talk to users and partner organisations and how we use people's lived experience. And then finally, there are policy considerations and choices in relation to social justice. And next slide, please. At the heart of our recent experience, though, has been this issue of equality and diversity. And I'm sure our speakers will speak about this, but the shocking and unacceptable impact of this pandemic on existing inequalities, I think, should galvanise us and has galvanised ADASS into thinking, how do we use the value base in social work and in social care to try and address this going forwards and to try and put this into reform? And last slide, please. And the last slide, when it appears, is about how we give ourselves a conversational start to where we take this. So ADASS aren't presenting ourselves as knowing the answer to all of these questions, but we do feel in working on this priority, we have to go forward with a higher level of conversation and interaction with others to learn what tools we need to use to address this issue about greater social justice. So if I could start then with asking our panelists to begin. And first on the list is Dr. Amy Pollard from the Mental Health Collective. Amy is the founder and brings over 15 years worth of experience. She was telling me before the session she's used to a round of applause, so I don't know how we're going to engineer that for her, but we will certainly try. And she presents from I guess a range of experiences, including lived experience. So over to you, Amy, please.